Resi OPEP, your mucus clearance device.
In many chronic pulmonary conditions, there was a buildup of secretions in the airways. These secretions, if left in your airways, block air passages, make breathing difficult, and provide an ideal environment for bacteria to multiply and thrive, all a primary cause of progressive, irreversible lung damage. Therefore, airway clearance is critical to your overall care. Daily airway clearance with the Resi OPEP device can help break this cycle of lung infection and damage.
Although your healthcare professional has already trained you in the use of your Resi OPEP device, this video will assist you in using your Resi OPEP mucus clearance device independently.
The Resi OPEP device is a device used to help loosen, mobilize, and eliminate mucus from your airways. The Resi OPEP device consists of 4 parts: a mouthpiece stem, a circular cone, a high-density stainless steel ball, and a protective cover. When you breathe out through the Resi OPEP device, your breath moves the steel ball inside. This causes airway vibrations that loosen mucus and also causes a slight increase in pressure that aids in keeping your airways open. Mucus is then able to move up the airways to be coughed out. Proper use of your Resi OPEP device is important for successful therapy. There are different Resi OPEP device techniques, but the one presented here is used most often.
Stage 1 is mucus loosening and mucus mobilization.
Begin by being relaxed. Sit with your back straight and head tilted slightly upward so your throat and windpipe are wide open. This allows exhaled air to flow smoothly from your lungs out through the Resi OPEP device. Put the Resi OPEP device in your mouth with your lips closed around the stem. The angle at which you hold the Resi OPEP device is very important. Holding it with the stem in line with the floor, place the cone at a slight angle and ensure that the ball not only bounces or flutters when you breathe out, but also rolls. While performing, experiment by tilting the Resi OPEP device upward and downward, because you may get a greater fluttering sensation in your chest when the stem is in a tilt position than you do when the stem is in line with the floor. For best results, use the angle that gives you the strongest fluttering sensation. While performing Resi OPEP therapy, it's important to keep your cheeks as stiff as possible, since the vibrations produced by the Resi OPEP device are wasted when they are used up in your cheeks. Look into a mirror or hold your cheeks flat with your other hand to help keep your cheeks stiff. Now to begin slowly, breathe into approximately 3/4 of a full breath. After holding your breath for 2 to 3 seconds, begin to breathe out through the Resi OPEP device at a reasonably fast but not too forceful speed. Think about feeling the vibration in your airways, since the best results are obtained when there is maximum fluttering in your chest. Breathe out through the Resi OPEP device to a level slightly further than you would during normal breathing without the Resi OPEP device. At this point, the urge to cough should be suppressed. Repeat the breathing technique for 5 to 10 breaths to loosen and mobilize as much mucus as possible from your airways. Each breath through the Resi OPEP device moves the mucus further up your airways. Remember, during these loosening mobilization breaths, it's important to inhale slowly, hold your breath for 2 to 3 seconds, and as you breathe out, suppress your urge to cough.
Now you're ready for stage 2.
Mucus elimination with coughs. To accomplish mucus elimination, perform 1 or 2 additional breaths through the Resi OPEP device. This time, breathe in slowly and fully as comfortably possible. Really fill your lungs with air again. Hold your breath for 2 to 3 seconds. Now, breathe out forcefully through the Resi OPEP device as completely as you comfortably can. This forceful breath moves the mucus up to a level in your area that triggers a cough. If mucus is not easily coughed out following 1 or 2 elimination breaths, attempt a huff cough maneuver. The standard series of 5 to 10 loosening mobilization breaths with cough suppression, followed by 1 or 2 mucus elimination breaths with a cough, should result in successful airway clearance.
Beginning Resi OPEP device users, or those with particularly thick mucus, may learn that multiple repetitions of Stage 1 mucus loosening mobilization are necessary before performing Stage 2 mucus elimination. Several trials may be necessary to determine the appropriate number of breaths you need to perform in each stage. Generally, morning and late afternoon or evening sessions ranging from 5 to 15 minutes are common. You can avoid becoming overly tired by adding a session instead of extending any one session to a point of discomfort. The inability to cough out additional mucus is often an indication that the session was successful and can be ended. Occasionally, your flutter therapy routine may need to be modified to maximize therapeutic effectiveness. Therefore, it is important to consult with your healthcare professional routinely or whenever you have any questions or concerns.
Remember, the primary goal of airway clearance therapy is to comfortably and efficiently remove as much mucus as possible. The Resi OPEP device will assist you in achieving this goal. Refer to your patient instruction manual for complete usage information. Review how to clean the Resi OPEP device because with proper care, the Resi OPEP device will provide years of beneficial use.
Resi OPEP, your mucus clearance device.
For more information, contact www.analmed.ch.